This is our video for the pharmacology project on Pantoprazole by Hunter Hausman, Corey Wagner, and Jason Hubbard. Pantoprazole's chemical makeup is C16H15 F2N3O4S, and it can also be called by its brand name Protonix or its generic name Pantoprazole sodium. Pantoprazole is a proton pump inhibitor, which means that its main action is a pronounced and long-lasting reduction of gastric acid production, and in this case, limit the production of acid in the stomach and the esophagus. The medication comes in the form of a tablet, but also could be administered as granules that you mix into applesauce or apple juice. It can also be taken through an IV. Pantoprazole is prescribed by a physician and must be obtained by a pharmacist. Some of the uses might include treat stomach and esophagus problems like acid reflux, may relieve heartburn, difficulty swallowing, and persistent cough. It might help heal acid damage to the esophagus and the stomach, helps prevent ulcers and cancer of the esophagus, and it's known to treat gastroesophageal reflux disease, or GERD. Pantoprazole may also help treat esophagitis and gastritis, which is inflamed esophagus or stomach lining. Another use is that it can be used for Zollinger-Ellison syndrome, a disease in which the stomach naturally produces too much acid. Some of the pharmacodynamics: it might block secretion of gastric acid. It's a proton pump inhibitor, so it suppresses the final step in gastric acid production. For the dosage, it is recommended that adults take up to 40 milligrams once daily with or without food. And for children, it is recommended that those who weigh between 15 and 40 kilograms take 20 milligrams for up to 8 weeks. And children over 40 kilograms take 40 milligrams once daily for 8 weeks. It is not recommended for children under the age of 5 to take pantoprazole. Those are recommended amounts. People should take the correct dosing on their bottle as prescribed. It's important to consume all the medication as directed. Do not stop taking once you think it's better. Some of the warnings: people with osteoporosis, which is when the bones become brittle, possibly due to lack of calcium in the body, among others. People with low blood magnesium, because pantoprazole can lower those levels in the body. Pregnant women might also want to contact their doctor before use, because there are insufficient studies that show there may or may not be damage to the fetus. Women who are breastfeeding might also take precaution, because the medication can be passed to the baby through the milk. Children's dosages must be also taken into precaution, and pantoprazole has been known to cause allergic reactions. Although it's rare, allergic reactions can turn into interstitial nephritis, a kidney disorder that can lead to kidney failure. Call your doctor right away if symptoms of nausea, vomiting, fever, rash, confusion, blood in the urine, or bloating is experienced.
And now we're on to the side effects. Some of the side effects include headaches, stomach pain, diarrhea, nausea or vomiting, gas, joint pain, and dizziness. And there's some more serious side effects that include seizures, abnormal or fast heart rate, tremors, muscle weakness, jitterness, dizziness, spasms in the hand or feet, cramps or muscle aches, and spasms of your voice box. And over here to the interactions with other drugs. HIV drugs can decrease the blood levels and reduce the ability to control the infection. Anticoagulants can increase the INR, and PT can lead to the possibility of severe bleeding. And stomach pH, the absorption of certain drugs can be reduced. Some of these include iron salts and ampicillin. Ampicillin.
It can be contraindicated in patients with known hypersensitivity to any component of formulated or substituted benzimidazole. Hypersensitivity can include anaphylactic shock, acute interstitial nephritis, and urticarial.